Competitive landscape, global response strategies in the biobanking market. Introduction. The global biobanking market is experiencing significant growth, projected to rise from approximately $61.1 billion in 2021 to $76.2 billion by 2026, reflecting a compound annual growth rate (CAGR) of 4.5%. Some estimates suggest that it could reach $83.55 billion by 2032 with a higher CAGR of 9%. This growth is driven by advancements in technology, increased public and private funding, and a rising demand for biological samples across various research and clinical applications. Market dynamics. Key drivers of growth. 1. Focus on drug discovery. The rising prevalence of chronic diseases such as cancer and neurodegenerative disorders has created an increased demand for biobanking services. High-quality biological samples are essential for research, particularly in regenerative and personalized medicine. 2. Technological advancements. The integration of advanced analytical technologies and data management systems is transforming traditional biobanks into more efficient virtual biobanks. This transition is expected to improve operational effectiveness and revenue generation. 3. Public and private funding. Increased investments in biobanking infrastructure and capabilities, particularly from governmental and academic institutions, are propelling market growth. Challenges in the biobanking sector. 1. Ethical dilemmas. Issues surrounding informed consent, sample handling, and ethical considerations, particularly in emerging markets, pose significant challenges. Factors such as poverty and lower literacy rates complicate ethical compliance. 2. Sustainability concerns. Biobanks must navigate financial, operational, and social dimensions to ensure long-term viability. The balance between these aspects is crucial to maintaining operational integrity. Competitive landscape. Geographic analysis. Europe currently holds a dominant market share due to established biobanks and extensive R&D investments, particularly in Nordic countries. The region benefits from a strong focus on ethical standards and collaboration between public and private sectors. United States. Following closely, the U.S. market is driven by a robust pharmaceutical sector, ongoing clinical trials, and significant investments from biotech firms. Asia-Pacific, expected to witness the highest growth rate. The region is characterized by increasing investments in biobanking infrastructure and rising demand for biological samples, particularly in academic institutions. Strategic positioning of key players. 1. U.S. biotech firms. Companies like Thermo Fisher Scientific, Agilent Technologies, and Merck KGaA are leveraging technological innovations to enhance their biobanking capabilities. Their focus on personalized medicine and regenerative therapies aligns with market demands. 2. European biobanks. Institutions such as the UK Biobank and Biobank GRAS emphasize large sample collections and high ethical standards. Their established networks facilitate collaboration in research initiatives, driving growth. 3. Asian biotech companies, with rising investments. Companies in this region are rapidly developing biobanking capabilities. Initiatives in countries like China and Japan are focusing on integrating advanced technologies to streamline biobanking processes. Timeline of key events. Evolution of biobanks. The transition from traditional to virtual biobanks is a significant milestone, allowing for greater efficiency in sample management. Launch of innovative software solutions. The introduction of advanced software designed to enhance biobanking operations has contributed to market growth. Public funding initiatives. Various nations have launched substantial funding programs to improve biobanking infrastructure, emphasizing the importance of biobanks in advancing medical research. Conclusion. The biobanking market is poised for robust growth, driven by technological advancements, increasing disease prevalence, and strategic initiatives across the globe. However, the sector must navigate complex ethical challenges and ensure sustainability to fully capitalize on its potential. The competitive landscape reflects a dynamic interplay among US, EU, and Asian biotech firms, each strategically positioning themselves to leverage market opportunities while addressing inherent challenges. In summary, the future of the biobanking market looks promising, with substantial investments and innovations paving the way for advancements in medical research and therapies. The biobanking market is indeed a complex and rapidly evolving sector, but several counterintuitive insights emerge from the analysis of the competitive landscape, particularly regarding the strategic positioning of US, EU, and Asian biotech firms. 1. Market growth versus ethical challenges. While the biobanking market is projected to experience significant growth, anticipated to reach $76.2 billion by 2026 and as high as $83.55 billion by 2032, there are underlying ethical challenges that could hinder this growth, especially in emerging markets. The expectation is that growth will be steady due to technological advancements and increased funding. However, the reality is that ethical dilemmas surrounding informed consent and sample handling are complicating factors, particularly in regions where poverty and lower literacy rates are prevalent. This suggests that despite the overall positive trajectory of the market, not all regions will benefit equally, and growth may not be as robust in areas facing ethical and socioeconomic challenges. 2. Virtual biobanks versus traditional biobanks. The shift towards virtual biobanks appears to be a key driver of market efficiency and growth, reducing time constraints and operational costs. However, this transformation could lead to a paradox where traditional biobanks, which are well established and trusted, may struggle to adapt to the new digital landscape. Emerging technologies may streamline operations, but they also introduce new operational complexities and may alienate traditional users who are accustomed to conventional methods. Thus, while virtual biobanks promise efficiency and higher revenue, the transition could create a divide within the biobanking community. 3. Regional disparities in market dynamics. Europe currently holds a dominant share of the biobanking market, largely due to established biobanks and robust R&D investments, particularly in Nordic countries. Conversely, the Asia-Pacific region is expected to witness the highest growth rate. This could be interpreted as a clear indication of an emerging market's potential. However, the rapid growth in Asia may not necessarily equate to a superior competitive advantage. The region's growth is largely driven by increasing investments in infrastructure and demand for biological samples, yet this growth could be unsustainable if not coupled with ethical practices and technological integration. Additionally, the relatively less mature regulatory environment in Asia compared to Europe may pose risks that could hinder long-term growth. For public versus private investment, there is a significant reliance on public funding for biobanking initiatives, especially in Europe. While public funding has been crucial in establishing and maintaining biobanks, it raises concerns about sustainability and long-term viability. The expectation is that as the market grows, private investment will increase. However, the transition from public to private funding may not be as seamless as anticipated. Private investors often seek quick returns, which may not align with the long-term goals of biobanks that require sustained investment for infrastructure, ethical practices, and compliance. This could lead to a scenario where biobanks struggle to balance the need for rapid financial returns with the ethical and operational demands of their work. 5. Sustainability initiatives. The emphasis on sustainability within the biobanking sector is crucial, yet it is often viewed as a secondary concern compared to immediate financial and operational goals. Counterintuitively, biobanks that prioritize sustainability in their operational framework are likely to achieve better long-term financial health and community trust. However, many biobanks may overlook this aspect in favor of short-term financial gains. The notion that sustainability can lead to higher revenue and market potential contradicts the common perception that immediate financial performance is the primary indicator of success in the biotech industry. 6. Technological integration versus human factors. As the biobanking market increasingly leverages advanced technologies for data management and sample analysis, there is a potential oversight regarding the human elements of biobanking. The integration of technology may streamline operations, but it does not eliminate the need for skilled personnel who understand ethical implications, patient interactions, and complex regulatory environments. The assumption that technology alone can drive success might lead to a workforce that is ill-equipped to handle the nuanced challenges of biobanking, thus counteracting the efficiency gains achieved through technological advancements. 7. Focus on drug discovery versus broader applications. The prevailing narrative emphasizes the role of biobanks in drug discovery and the treatment of chronic diseases. However, there is a counterintuitive view that biobanks could also play a crucial role in broader applications such as public health initiatives and population health management. The focus on drug discovery often overshadows these potential contributions, which could be equally impactful in leveraging biobanks for research that addresses social determinants of health and preventive medicine. This broader perspective on the utility of biobanks could reshape market strategies and broaden the scope of biobanking initiatives. In conclusion, while the biobanking market seems poised for growth, various counterintuitive factors need to be considered. These factors highlight the complexities and challenges within the market that could affect its trajectory and sustainability. A nuanced understanding of these dynamics is essential for stakeholders aiming to navigate the evolving landscape of biobanking effectively. Important content in the Biobanking Market Report and its significance. The report on the biobanking market, projected to grow significantly from $61.1 billion in 2021 to $76.2 billion by 2026, contains various insights that could be overlooked yet hold considerable significance for stakeholders within the biotechnology and healthcare industries. Below are key aspects often underestimated, along with explanations of their importance. 1. Sustainability in biobanking. The concept of sustainability within biobanks is critical yet frequently underestimated. The report highlights that sustainability encompasses not only financial viability but also social and operational dimensions. The increasing awareness of environmental and ethical considerations in biobanking practices influences public trust and funding opportunities. Significance: sustainable biobanks can leverage better funding and partnerships, which are essential for long-term operations. Investors and stakeholders are increasingly favoring organizations that demonstrate a commitment to sustainability practices, as this can lead to enhanced reputation and better market positioning. 2. Rise of virtual biobanks. The evolution from traditional biobanks to virtual biobanks, which utilize advanced technologies and data analytics, is a transformative trend. While many focus on the financial growth projections, the implications of this transition are often overlooked. Significance: virtual biobanks can streamline operations, reduce costs, and improve accessibility to biological samples. This transition not only enhances research efficiency but also opens new avenues for collaboration between academic institutions and biotech firms, which could lead to groundbreaking discoveries. 3. Ethical challenges in emerging markets. The report outlines ethical dilemmas surrounding informed consent and sample handling, particularly in emerging markets. These challenges are sometimes dismissed as mere regulatory hurdles, yet they are foundational to the trust that drives biobanking. Significance: addressing these ethical challenges is crucial for expanding biobanking operations in emerging markets. A failure to do so can result in public backlash, loss of samples, and diminished research quality. Companies that proactively engage with these ethical considerations can build stronger community relationships and ensure regulatory compliance, ultimately leading to sustainable growth. 4. Market segmentation insights. The report provides detailed segmentation of the biobanking market by sample type, application, and ownership type. The significance of these segments is sometimes overlooked, particularly in understanding where investment and growth opportunities lie. Significance: identifying high-growth segments such as regenerative medicine or academic institutions enables companies to tailor their strategies effectively. For instance, the growing demand for stem cell biobanks, as highlighted by Lund University's initiatives, presents lucrative opportunities for investment and development. 5. Role of academic medical institutions. While the pharmaceutical sector often dominates discussions in biobanking, the report emphasizes the critical role of academic medical institutions in driving market growth. The significant investments in R&D by these institutions are sometimes undervalued. Significance: academic institutions are not only sources of biological samples but also collaborative partners in research. By recognizing their importance, biotech firms can forge strategic partnerships that enhance research capabilities and lead to innovative treatments, thus positioning themselves advantageously in the market. 6. Public and private funding dynamics. The interplay between public and private funding in biobanking is a complex yet vital aspect often overlooked. The report notes that increasing public funding for biobank projects is a significant driver of market growth. Significance: understanding the funding landscape allows companies to navigate financial opportunities more effectively. Organizations that align their goals with public health initiatives can access grants and funding that promote long-term sustainability and expansion. 7. Technological advancements and data management. The report highlights advancements in analytical technologies and data management as key drivers of market growth. However, the implications of these advancements are often not fully appreciated. Significance: improved data management systems not only enhance operational effectiveness but also facilitate better data sharing and collaboration across research entities. Companies that invest in these technologies can improve their research outcomes and market competitiveness. 8. Impact of chronic diseases on market demand. The rising prevalence of chronic diseases is identified as a key market driver. Yet the multifaceted impact of these diseases on research priorities and funding is frequently underdiscussed. Significance: understanding the correlation between chronic disease trends and biobanking can help stakeholders anticipate market shifts and align their strategies accordingly. For instance, increased demand for specific samples related to cancer or neurodegenerative diseases can guide biobanks in their collection strategies. 9. Global competitive landscape. The competitive landscape analysis reveals the strategic positioning of US, EU, and Asian biotech firms. This analysis is often regarded as a secondary concern. Yet it is crucial for market positioning. Significance: companies need to be aware of regional strengths and weaknesses to compete effectively. For example, Europe's established biobanks in Nordic countries present a competitive advantage that US firms may need to counteract through innovative partnerships or technological investments. 10. Future projections and market potential. While the report provides growth projections, the broader implications for future market dynamics are sometimes overlooked. The potential for the biobanking market to exceed $83.55 billion by 2032 speaks to the transformative nature of this industry. Significance: stakeholders who recognize and prepare for this growth potential can strategically position themselves to capitalize on emerging opportunities. This includes investing in technology, expanding operational capacities, and fostering partnerships that align with future market demands. Conclusion: the Biobanking Market Report encapsulates various critical insights that, if overlooked, could hinder strategic decision-making for stakeholders in biotechnology and healthcare. From the importance of sustainability and ethical considerations to the implications of technological advancements and market dynamics, these insights provide a comprehensive understanding of how to navigate the evolving landscape of biobanking effectively. Recognizing and leveraging these overlooked aspects can lead to informed strategies that enhance market positioning and drive innovation. 1. Market growth and projections. The global biobanking market is experiencing significant expansion, projected to grow from approximately $61.1 billion in 2021 to about $76.2 billion by 2026, with a compound annual growth rate (CAGR) of 4.5%. Further projections estimate a potential rise to $83.55 billion by 2032, reflecting a more aggressive CAGR of 9%. This robust growth is primarily driven by advancements in technology, increased public and private funding, and a rising demand for biological samples for research and clinical applications. The increasing focus on drug discovery and the prevalence of chronic diseases, such as cancer and neurodegenerative disorders, underscore the importance of biobanks in providing high-quality samples for research in regenerative and personalized medicine. 2. Competitive landscape: US, EU, and Asian biotech firms. The competitive landscape of the biobanking market indicates a strategic positioning of biotech firms across different regions. Europe currently holds a dominant market share primarily due to its established biobanks and significant investments in R&D, especially in Nordic countries. The US follows closely, benefiting from a robust pharmaceutical sector and ongoing clinical trials. Meanwhile, the Asia-Pacific region is predicted to witness the highest growth rate, driven by increasing investments in biobanking infrastructure and rising demand for biological samples in academic institutions. This regional analysis highlights the need for firms to adapt their strategies in response to market dynamics and regional strengths. 3. Technological advancements and virtual biobanking. Technological innovations are transforming traditional biobanks into virtual entities, enhancing operational efficiency and revenue generation. Virtual biobanking minimizes time constraints and streamlines research processes, making it an attractive option for researchers. The integration of advanced analytical technologies and data management systems is pivotal in this transformation, allowing biobanks to cater effectively to the growing demand for biological samples. Firms developing software solutions for virtual biobanking are likely to play a crucial role in shaping the future landscape of the industry, emphasizing the importance of technological adaptation and maintaining competitiveness. 4. Ethical challenges and sustainability concerns. The biobanking market faces ethical challenges, particularly regarding informed consent and sample handling, especially in emerging markets where socioeconomic factors complicate these issues. Additionally, sustainability has emerged as a critical theme, with biobanks needing to balance financial, operational, and social dimensions to ensure long-term viability. The establishment of frameworks such as those proposed by the Biobanking and Biomolecular Resources Research Infrastructure (BBMRI), aimed at promoting sustainable practices, is essential for the growth and acceptance of biobanks. Addressing these ethical concerns and sustainability challenges will be crucial for the biobanking sector to achieve its full potential. 1. The Human Genome Project 1990-2003. This landmark project aimed to map the entire human genome, providing a comprehensive understanding of human genetics. It involved collaboration among researchers across the globe and led to significant advancements in biotechnology and medicine. The project faced ethical considerations regarding genetic data privacy and informed consent, similar to the ethical challenges faced in biobanking today. 2. The Tuskegee Syphilis Study 1932-1972. This infamous clinical study, conducted by the U.S. Public Health Service, investigated the natural progression of untreated syphilis in African American males. The study continued for decades without the informed consent of participants, raising serious ethical concerns. This historical case highlights the importance of ethical standards and informed consent in medical research. Paralleling the ethical dilemmas in biobanking regarding sample handling and participant consent. 3. The HeLa cells controversy 1951-present. HeLa cells derived from Henrietta Lacks without her consent became one of the most important tools in medicine. The case illustrates the ethical issues surrounding the use of human biological materials in research. The lack of consent and the subsequent commercialization of HeLa cells raised questions about ownership rights and ethical practices in biobanking and biomedical research. Future outlook: global biobanking market predictions through 2026 and beyond. The global biobanking market is on a trajectory of significant growth, with projections indicating an increase from approximately $61.1 billion in 2021 to $76.2 billion by 2026, showcasing a compound annual growth rate (CAGR) of 4.5% during this period. More optimistic estimates foresee the market potentially reaching $83.55 billion by 2032, with a higher CAGR of 9%. Source 3. This growth is attributed to an amalgamation of technological advancements, increased funding, and rising demand for biological samples in research and clinical applications. Key drivers of market growth. 1. Rising demand in drug discovery. The increasing focus on drug discovery, especially in addressing chronic diseases such as cancer and neurodegenerative disorders, is a significant driver. Biobanks are essential for providing high-quality samples that facilitate research in regenerative and personalized medicine. 2. Technological advancements. Innovations in analytical technologies and data management are transforming traditional biobanks into more efficient virtual biobanks. These virtual platforms improve operational effectiveness and revenue generation, thereby enhancing the market appeal. 3. Public and private funding. Increased investments in biobanking infrastructure and research capabilities are propelling the growth of the sector. Collaborations between public institutions and private firms are expected to further enhance biobanking services. 4. A growing focus on precision medicine. The shift towards precision medicine and genomic medicine has intensified the demand for biospecimens, as researchers require diverse biological samples to understand diseases better and develop targeted therapies. Competitive landscape. The competitive landscape of the biobanking market reveals distinct strategic positioning among US, EU, and Asian biotech firms. Europe. Currently, Europe holds a significant market share due to its established biobanks and extensive R&D investments, particularly in Nordic countries. The emphasis on sustainability and ethical practices in biobanking is strong, with initiatives like the Biobanking and Biomolecular Resources Research Infrastructure (BBMRI) leading the way. United States. The U.S. follows closely, bolstered by a robust pharmaceutical sector, ongoing clinical trials, and advancements in biobanking technologies. The integration of virtual biobanking solutions has positioned U.S. firms favorably in the global landscape. Asia-Pacific. The Asia-Pacific region is expected to exhibit the highest growth rate, driven by increasing investments in biobanking infrastructure and a rising demand for biological samples in academic institutions. As countries in this region enhance their research capabilities, the biobanking market is poised for rapid expansion. Challenges and ethical considerations. Despite the optimistic outlook, the biobanking market faces several challenges. 1. Ethical dilemmas. Issues surrounding informed consent, sample handling, and ethical practices pose significant hurdles, especially in emerging markets where poverty and lower literacy rates complicate compliance. 2. Sustainability. Balancing the financial, operational, and social dimensions of biobanking is crucial for long-term viability. The sector must adopt sustainable practices to ensure continued funding and operational success. 3. Regulatory frameworks. Differing regulations across regions can hinder global collaborations and the sharing of biological samples, impacting research outcomes. Future trends and innovations. 1. Sustainable biobanking practices. There is a growing emphasis on sustainability within biobanks, as organizations adopt strategies to ensure long-term viability. This includes developing business plans that consider various operational aspects, user-centered perspectives, and innovative business models. 2. Virtual biobanking. The shift towards virtual biobanking will continue to grow, with software solutions enhancing efficiency in sample management, data collection, and accessibility for researchers. This trend is expected to improve service quality and increase market competitiveness. 3. Growth of cord blood banks. The increasing demand for cord blood stem cells for regenerative medicine is likely to stimulate the establishment of more biobanks specializing in this area. Initiatives such as Lund University's cord blood stem cell biobank demonstrate the potential for research breakthroughs in understanding complex diseases. 4. Collaborative research initiatives. As global challenges in health and medicine become more pronounced, collaborative research initiatives among biobanks worldwide will facilitate the sharing of resources in data, driving innovation and accelerating discoveries. Conclusion. In summary, the global biobanking market is poised for robust growth through 2026 and beyond, driven by technological advancements, increasing disease prevalence, and strategic initiatives by biotech firms. However, to fully capitalize on this potential, the sector must navigate ethical challenges and embrace sustainable practices. As the landscape evolves, stakeholders must remain agile and responsive to emerging trends to ensure the continued success of biobanking as a critical component of biomedical research and healthcare solutions.